Hello, I'm Mabel Jong. You're watching continuing coverage of the World Healthcare Congress 2012 in Washington, D.C. And here with me now is Dr. David Lansky, President and Chief Executive Officer of Pacific Business Group on Health. And you work with 50 large employers, and that represents about 3 million
Californians, probably 10 million nationally. A lot of them are large national employers.
Yes.
Wells Fargo, Target, Boeing, companies like that.
What is happening that's unique to California against the backdrop of health reform?
Yeah. Of course, California had a long managed care tradition. So for many years, California has had big medical groups and hospital foundations that have organized care quite well for the HMO product. So the movement of the Affordable Care Act toward accountable care organizations has been a little easier in California. A lot of the groups know how to do that, but they're now trying to position themselves to get more of the PPO covered lives than in the old days when it was strictly HMO. So that's a good thing. I think we're seeing good movement toward medical homes, accountable care, coordinated care in much of California. We're very happy about that.
Now, what about pricing, disclosure, and also
I think we have a ways to
go.
We have a ways to go there. There are very big disparities in pricing in California. Northern California is much more expensive than Southern California, and the prices are not transparent to either the companies that are paying for the care or to the employee who's looking for care. And nowadays, with so many people having high cost sharing, high deductible plans, big percentage of their costs come directly to them, they don't know where to go to afford the care. We've seen 10-fold ranges in the cost of, say, a colonoscopy. From one ambulatory center to another, it'll be 10-fold different price.
How does that happen?
Hip and knee surgery from $15,000 in one hospital to $110,000 in another.
Wow.
So until the employee, the patient, knows that they're facing a big difference in costs, they need to see the data to be able to make those decisions.
Are you setting up exchanges, health exchanges?
California is actually ahead of the country in setting up a state-sponsored health benefits exchange.
Okay.
It's up and running as much as it can be prior to 2014. And I think they're moving very rapidly to set requirements for the health plans that'll be offered, what kind of quality information, what kind of transparency will be required. And I think there's a very good board that's directing that organization. It'll be up and running January 2014.
Okay, so right on schedule and in some effects ahead of schedule.
Yeah, they were the first state, I believe, to pass a law setting up the exchange.
Are you considering also are you seeing more cottage industry companies coming into play too to help manage some of this collaboration?
I think because of California's history with big managed care organizations, less so. For the most part, the energy we're seeing are the existing medical groups acquiring physician practices and ancillary services and building bigger and bigger integrated systems around the core medical group that they had. We're also seeing some health plans purchase medical groups and some hospitals merge with medical groups. So there's a lot of consolidation happening, and we are worried that it could be good if it leads to better coordination, but it could be bad if it drives prices up because people have essentially monopolies in certain geography and they can dictate the price to the market, and we are seeing a little bit of that.
Is that a little bit maybe jumping the gun since we don't know what parts of the law will actually be legal?
I think in California the market is driving even faster than the law, that the healthcare systems want to build bigger integrated models, and that's probably a good thing on the whole, but we are worried about price setting being a consequence of it.
Mm-hmm. As you said, you represent companies, employers across the country.
Right.
So is that difficult to manage given that you are based in California and you now have to manage some of the systems in other states?
No, not particularly. I think everyone is now virtual and national. But what we have seen is that the health plans have become so much consolidated as national plans, the very large United, Aetna, WellPoint, that we have to interact with them at a national level. Our members have employees everywhere. So one of the issues for us for exchanges, for example, is do we have national uniformity? So if I'm Wells Fargo or Safeway and I have employees everywhere, I don't want to have a different exchange rules in every different state. I want to know that I can administer a benefits program uniformly to all of my employees. So I think it's become essentially a nationalized health system, even though we don't call it that. A lot of the control and influence has to be administered nationally rather than regionally as it was 20 years ago.
Okay, Dr. Lansky, thank you. Have I missed anything, any other messages you want to share with us today?
No, I think we've covered some good topics. Thanks for having me.
Terrific. Thank you, Dr. Lansky.
Right,
stay there for one moment. And I'm Mabel Jong. Thanks for watching.